How's that?
That's great. Hi.
Hi, Heather.
How are you? How are you?
Good, good. Busy, but we're doing good. PEI's been another adventure in early childhood education, but I'm liking it here.
I'm sorry, did you say busy? I can't possibly imagine why you're busy.
I can't either.
Isn't this a time of relaxation and cross-stitching and reading books and cleaning closets?
No, I think I've been doing puzzles and running and walking a lot, but also it's just been work after work. I've still been doing like 35 to 40 hours a week, just handling, well, you know, director stuff.
I've actually been working 12 hours a day. I didn't expect that, and I'm shocked. And I'm doing it to myself because I'm having all kinds of Zoom meetings with friends who are providers in the States and all kinds of support groups and talking to me. You know, it's just what I do. I just like, you know, and I probably shouldn't be doing that because I'm exhausting myself, and then I'm not really necessarily going to be 100% for my team. And I brought all this stuff home. I don't know if you can see it or not. You probably can't. I brought all this.
Oh my gosh.
Because I had this imaginary thing in my head that for due resources, because it's been like in hiatus, I would reactivate it and start it again. And I do all these cool activity videos and discuss the approach. And I haven't gone near any of that stuff. So yeah, anyway.
And more importantly, how'd you get your hair short? Look, I'm waiting on a haircut.
Well, my hair is short because I used my dog clippers on them.
I'm not that adventurous yet.
Yes, well, I was going to ask you, like, usually you have like purple or something. And
it all grew out.
Yeah.
Yeah.
So I don't have purple or anything either. So we miss you in Nova Scotia.
Oh, I miss Nova Scotia.
And it's very nice to still have you be a part of the big group and get information from. So usually when I Zoom, because I've been Zooming since March 17th, I usually use my laptop. And so the reason was, and I have used my phone once or twice, but we were originally supposed to be closed like March break week. So we were open for that Monday so parents could come and get stuff. Then we were to be closed for that week, as were schools because it was March break. And then 2 weeks afterwards, and then reopening kind of thing.
Right.
So what we did as a team during that time frame was we just sent the parents little posts, whether it was a storybook reading or a little paragraph about a memory about the center or just something like that to keep a connection. And after that was over, we decided we would start doing Zoom circles, gatherings. So like the baby room once a week has a little Zoom thing where the baby teachers sing to the babies or whatever. And so, like I said, through all of the Zooming, it's been the laptop. So there's a reason why I'm saying all this, Kathleen, is because I wanted to be able to actually write on the PDF while we talk about it. And I don't know how to do that on my laptop, but I do know how to do it on my iPad.
You have to know that I'm in rural PEI, and the internet connection here, there's no such thing as fiber optic in Prince Edward Island. The internet connection lags quite a bit, so hopefully you can always hear me.
Okay, that explains why I can hear you right now, but for several moments, I just saw you like this.
We have no fiber op. It's crazy. Our internet connection is like dial-up some days.
But maybe it's nice. Maybe that's a treat. Maybe a slower world is a treat.
Everything goes slow.
Well, we're pretty slow compared to Toronto and all those other places. So
yeah,
it's all relative. It's all good. Okay, so
you obviously, I sent you the form. You know that we are reopening for the 22nd of May to staff and the 25th of May to children. The first Friday we'll be getting our centers ready with all the work we have to do. We have to remove carpets, all stuffed toys, all dress up clothing, anything that's not washable surface. We have to remove a lot of our toys in our classroom because the minister says the less toys that we have to clean, the easier it will be on us. So the 22nd is going to be getting the classrooms ready, and then we will accept children on the 25th as the mandate.
So the 22nd is a Friday.
Yes. We're
Sorry,
officially back to work on the 22nd.
Okay. And so do centers have an option? Because like I want to flip over to the document and have a conversation in a minute. But of course, I'm very visual. I like to see your face. And so I know that on my laptop, when I do a screen share on Zoom, I still see people's faces in the corner, but on my iPad, I won't see you, but I'll still hear you. So I'd like to go right to that. If we lose each other, I will simply just go to the laptop and we'll just do stuff there. We might have to restart the Zoom. But I've learned, I'm not an exceptional video editor, but I've learned bits and pieces over the past couple of weeks, so I can put it together later. Okay, so I'm gonna try right now to screen share and let's see if we can still talk. Okay, so I go up here and I go to screen. So at this point in time, you can still hear me?
Yes.
Okay. Okay, so here we go. You're going to see the screen of my laptop and my iPad. And then I go here. Okay. So, can you see this?
I still see and hear, I still see the Kids Are Kids logo now, not you, but I can hear you definitely.
And do you see the document?
Yes.
Okay. So it's going to probably seem crazy, but because of how my brain works, I feel like you and I was diagnosed 2 years ago with ADHD, whatever. Why the hell I got diagnosed at age 50. But anyway, I don't know if you have it. I got
diagnosed at 28.
There you go. All right. So we're literally and figuratively on the same page. Okay. So how my brain works is right here, right at the beginning. So we've got conditions for reopening. And then when it says childcare centers being considered to accommodate the needs of essential service. So that sentence there suggests to me that centers can choose to not open because it says childcare centers being considered. So is it all centers?
What happens is currently all centers are being funded as to not lose wages and to not lose any income. So we are being reimbursed by the province. All our provincial grants are stayed the same. All of our provincial funding for autism, funding for special needs funding has stayed the same. All of our parent fees that we lost during COVID are being reimbursed. So all of our staff are currently being paid 100% of their wages, and we just maintain. There are 22 centers currently who chose to open previously for emergency childcare only. What's happening on the 22nd is you still can have the option. You may open or you may stay closed, but if you stay closed, all funding stops, which means you then lose funding and your staff are no longer paid. So up until now, emergency childcare was optional, and on Prince Edward Island, 22 centers chose to open, and they opened with these exact regulations in place, protocols in place. But after May 22nd, if you choose not to open, funding stops.
Okay. All right. And so those centers that have continued to be open, did they, like, you guys closed, and did you guys close the same date as us or no?
May 16th.
Okay, same date, March 16th.
March 16th, sorry.
So
it all rolls into one now.
So did they close for a couple of days and then they got this information and reopened those 22 centers?
No, they closed for a couple of weeks, actually. They didn't actually reopen until the first week in April. So like the first 3 weeks, nobody was open. And then they went and had a lot of meetings with the center directors and asked anybody who would volunteer to open. And the staff still were optional. So even though your center volunteered to open, your staff did not have to be there. So there are some centers that opened their center, their location, but they had staff who volunteered from centers who remained closed to work there. So it was kind of all on a volunteer basis.
Isn't that fascinating? So fascinating. Okay. All right. So again, I just for anybody who's going to watch this afterwards when I share it, and for you, for your knowledge, because you know what, I have a degree in child study, so
As do I.
You know, no degree in Zoomology, no degree in technology. So if we were on my laptop just now when you and I were chatting, I would have known how to leave the screen share and have eye-to-eye contact, but I can't do that on the iPad. So anyway, okay, so I'm just gonna, this is really just for, not that anyone really cares, but it's very fascinating to me that there's a typo there and that it's not early learning, but it's early leaning. That's irrelevant, but I just thought I'd just point that out. So, so all centers then are opening. If they choose to not open, they lose the funding. Got it. Okay.
Exactly.
And it is, and I want to say for the record, since I'm talking directly to you, that it's so wonderful of both Nova Scotia and PEI to be providing the consistent funding, because we really are the only two provinces that did that. And,
absolutely. And I heard you this morning on your little blog there this morning on the site, and we absolutely thank our province all the time. We send them letters, we send them notes, everything. When we have our Zoom meetings with the province, it always ends in a lot of thank yous, and we're very appreciative that they maintain that funding and that they replaced all lost parent fees.
well, as I said, over the past 7 weeks or however many weeks it's been, I've been in a lot of Zooms with like people from right across the country, and I've been in some group Zooms with people from like in the same Zoom, people from numerous states and provinces. And so sometimes I've been in groups, like I said, with that many people and people from other provinces. Basically the second they hear, like we sort of do a go around, and the second they hear that I'm from Nova Scotia, they're like, oh my God, you guys are so lucky. The ECE here, they're all laid off. They're this, they're this, they're this. Your province is amazing. And so then I say, and PEI too. Oh yes, we've heard that. So it's quite something. It's quite validating and reassuring. So now down here where it says next paragraph, these, and I think it's very, the bolded thing in the first paragraph, these centers are subject to inspection at any time. So you're
Yes.
telling me that the 22 centers that opened for essential care, this has been the document the entire time. So for example, Corey Berg, I don't know if you've watched any of her stuff.
Yes.
So she often will explain a new procedure to her team, and like less than 24 hours later, they have an email with a completely new switch in policy or procedure. But this has been the consistent document for them for the whole time, those 22 centers?
Yes, this is a consistent document that they've had. Now, last night at our Zoom meeting that we had with the province, there are three slight modifications that they're willing to make for May 22nd, which I'll discuss with you later when we go through the different requirements. But it is the consistent document. And when you talk about the subject to inspection anytime, I've been speaking with some of the directors who actually opened. They were receiving weekly inspections during this last 3 weeks or 4 weeks. And some of them have actually had biweekly inspections. So the inspectors have been coming in just to help them. And it's not so much to slap their fingers if they're not doing it right, but to help them in getting it right, to support them and to be there for them and to answer their questions and to walk them through all the different protocols to help.
Okay, all right, just making a note for myself. Okay, so down here, this next thing here, these centers will not be permitted to operate if they're within close proximity to a vulnerable population. So for myself, when it says community care facilities, so for myself, where my center is located, and I'm not saying this to make this all about me or my center, I'm just giving an example that I know that you are aware that my center is located in Bears Lake, and there is quite a large seniors complex off of Parkland, outside of the Bears Lake Business Park, but off of Parkland. And there's also a seniors complex down Main Avenue. So as you go up Wash Mill and you're heading down. So when they say close proximity, So I'm asking for everybody, because lots of people watching this, maybe they have a seat. I'm assuming vulnerable population, community care facilities. Am I correct in interpreting that as seniors' homes? Is that what that means?
Yeah, seniors home, definitely seniors home. But when they're talking vulnerable close proximity in the vulnerable population, they're really talking about a shared building. So if you have an early years center inside of a building, which is like a community building, which actually shares senior programs or a senior center, they're also talking that maybe if you share perhaps like a garden area, like if you're back to back and your playground will be right next to where the seniors may go out to garden. So it's really that type of a close proximity. It's not on another street or down the road or across the way or 10 houses down. It's really that close proximity that they defined it as. And
okay.
even now, with the new on May 22nd, they're still sticking with that. If you are within a senior's home or really, really close proximity, then you can actually not open. And in case of that, they will continue to fund you.
Okay, gotcha. So that is great clarity, because I was thinking, does this mean so many kilometers? Does this mean this? So that's good to know. And that makes a world of sense. And then of course, the next section, the giant bolded section, I don't feel like we need to discuss that. I mean, that's, I think anybody would expect, pardon me, excuse me, I just sort of hiccuped or yawned or something. That's just an expectation that we should have all had anyway, that if any of us test positive, child, staff member, etc., that we would be closing, etc., and that we need to notify health. So that part is very clear. And then I see that your province has their own COVID website, which all of us have. So then getting down into here, into the required public health measures. So with regards to everything I've heard from all kinds of provinces, states, and even other countries, this whole maximum capacity of 5 people in a room, that has been something that I've heard. I mean, even here, like for the past 7 weeks, companies that were considered essential companies, they haven't been permitted more than 5 people in a room. You know, some of the businesses, it's just sort of throws your mind, like, it's like, what, Best Buy is essential? Well, yes, Best Buy is apparently essential because some people need their computers fixed so that they can continue their work, because those people actually work for this place, which is essential, da, 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 da. So, but if you went to Best Buy, people were like lined up outside, and you put your computer in a card, a sanitized card, and it went in and you didn't go in with it, etc. So, but inside that building, those 5 people in Best Buy could only be in one, like, you know, so far apart, etc. So that is a very consistent thing, 5 people being very, very much the rule. So that's not surprising. It certainly makes logical sense that if siblings are present, they should be in the same group. We sort of chuckled about it because we have a couple of really big families at our center. So basically it would be a staff member in a room with the kids of that one family.
Yeah, that we have that too.
Yeah.
We have
Well,
some,
you know,
staff themselves have 4 children. So if that staff were to bring their 4 children, she'd virtually be in the classroom with her own 4 children, possibly.
There you go, right? There,
Crazy.
exactly right. Us maritime communities, we still have some prolific production in our families, for sure.
Sure do.
Okay, so I found it fascinating. It doesn't bear a lot of comment, but this was the licensing requirement for child staff ratios must be maintained at all times. Obviously, when they vetted it through their legal department, some lawyer said, you better put that sentence in there, because clearly if you're doing 1 staff member with 4 children, then clearly you're meeting staff child ratios. So
Well, I think that's pertinent right now, because we're only taking children from toddlers and up. We're not taking infants, which our licensing requirement is 1 to 3. So, so our infants are 1 to 3. So I think they put that there in the fact that we're not taking infants during phase 1, 2, or 3. Phase 1 is what's happening currently with the emergency childcare. Phase 2 is when we open on the 22nd. Phase 3, there's no change. So what they're telling us is we are staying with this set of guidelines for the next 2 phases, which we are not allowed to take infants. So I think that's in there just because they want to make sure that they know that we can't take infants.
Okay, so
Yeah, I think it has to do something with that. That's my interpretation of what's there.
okay, so I have now that brought up several questions. So when you're referencing phase 1, phase 2, phase 3, are you talking about Prince Edward Islands, phase 1, phase 2, phase 3, or you're talking about a phase 1, phase 2, phase 3 specific to centers?
Prince Edward Island, phase 1, phase 2, phase 3 has a specific to center phase embedded in it. So phase 1 for Prince Edward Island for childcare was the 22 centers that opened up voluntarily. Phase 2 is May 22nd when we open. Phase 3 begins on June 12th, which is 3 weeks after that, which there will be no change. And then there is no date for phase 4. So we could stay like this for 2 or 3 months. We could change in July. We don't know yet because there is no date listed for phase 4. It's all going to depend on what happens with COVID.
What is the difference between phase 2 and 3?
For childcare, nothing. For the province, there is the slight changes in different things that are allowed to open in phase 3.
Okay.
So it might be, your physiotherapist might be able to start taking patients in, or I can't recall them all because I'm very focused on the childcare piece.
Right. No, that's fine, Kathleen. That's fine. That's
definitely
fine.
Like for childcare, there's no change for phase 2 to phase 3.
And the people, I want to say the people watching this video, but I guess I should say the people listening to this video. Yeah, that's okay. We're okay with that because this is what we're all focusing on. So does this document actually say that there's no infants?
Let me double check, but
I did not see that. So in phase 1, no infants. Phase 2 and phase 3, no infants.
No infants.
Okay. So, and you have centers in PEI that are licensed for infant care.
Oh yes, all of our centers are.
Okay. And infants in PEI, same thing, 3 months to 18 months? Yes or no?
No, 0 to 22 months.
Oh my goodness. Do you have babies, like newborn babies in your centers?
We never have newborn babies in our centers. Everybody takes that 1 year mat leave, but I think the youngest child we've ever had is about 7 months where mom really had to go back to work. So we don't really take 0, but it is under, 22 months and under.
Because here the youngest you can take in a center. No, you know what? I'm correcting myself because at my program it's 3 months and up, and we have had children 3 months, even since the 12-month mat leave started. But I think I knew of a center before that had children at 6 weeks. So that's an interesting, different thing. Okay, let's get back to this because of our ADHD. We're gonna.
But it definitely goes to 22 months here.
That's interesting too. So your toddler definition starts at 22 months?
Yes.
Huh. And then your preschool definition, 36 months?
Yes, starts at 3.
Okay. All right. So the next thing here, any child, employee, or parent experiencing symptoms of illness not permitted to enter. So we had thought, because a lot of places, not just Corey's program in Texas, but numerous other places, parents were not allowed to enter. You had to have your health check station outside the building, and parents could never enter. And so reading this, it looks like children, employees, and parents can enter. The document, the appendix that's attached regarding symptoms, is that a conversation outside the center?
The appendix, the screening questionnaire that's in the appendix A is actually the questionnaire. Parents are allowed to enter the center just to the front door. They can come in the front door. There's a table set up there, and what the parent has to do is, prior to handing their child over to us, they have to fill out that questionnaire every single day, every single morning, and they have to sign it.
Okay.
So they have to fill it out. So you end up, what we have to do is we have to stagger entrancing. So each parent will have a set time when they will be able to drop off their child. So you might be designated 7:45. So when you come in at 7:45, you should be the only parent dropping off at that time. So they come in, they go through the front door, they come to the table, they fill out this form, they hand their child over to the staff member who's taking care of the child. We also have a disinfecting floater, which we call them a disinfecting floater, who will then disinfect the pen they use, disinfect anything they touch, disinfect the doorways, the handles, et cetera, et cetera, et cetera. The next parent would probably come in at 8 o'clock.
And so that person at the table, where the parent is filling, I'm assuming is it the disinfecting floater that is the one directing the parent to fill out the form, or is there someone there at the table?
I think we call them the disinfecting floater as sort of like a pun, but that person does a lot of the cleaning and does a lot of the helping where needed, but they cannot enter the room because then they would be over 6. But if a staff member had to go to the restroom, for instance, that disinfecting floater could cover them, swap out sort of, without being 6 in the room, and cover for a pee break, let's say. But what happens is that person could be the director. It could be another staff member if not all the children are there, as long as they follow the 6-foot distancing protocol and not get too close to the family. And as long as once the family's gone, they disinfect everything that was touched.
Okay. All right. My front entrance is so teeny, tiny. Okay. So, and again, not about kids are kids. It's about all centers. So I shouldn't have said that. All right.
I think when we're looking at the staffing, what the department is allowing us is, so we need a staff member for each of the 4 children.
Yes.
Each group of 4 children. If we have a child with special needs, we are allowed to take them, which means that room would then have 2 staff and 3 children.
So let's do this, Kathleen. I'm sorry to interrupt you because I have to see your face and stuff. So let me just zip through. Let's just zip through the things that I've like marked.
Sure. That's my ADHD too, right? I get off on tangent.
Well, I know. And it's like, oh, great. These 2 together. Woo. That's like anytime I go to a workshop and if any presenter sees Liz and I sitting together, because we get the giggles together. And so often people who know us are like, oh no, Heather and Liz are sitting together. So let's just zip through the things I've marked and then let's resume where we can see each other and we'll talk about like actual operations kind of thing. So I had expected parents couldn't enter. That's why I made that mark. You've clarified that. Then the next thing here where it says, if a child develops symptoms while at the facility, the child is to be isolated in a separate room. So maybe when we get talking about regular operations, because that I found a little bit confusing, because if I have all 5 rooms going, then where, but it then says, it says separate room or area. So that could be like the director's office, I guess, where required social distancing from other children can be maintained. Why I really underlined that was it sounds confusing because it's like they're supposed to go to a separate room or area. And initially my brain thought that meant away from the other children. But then by saying where the required social distancing of 2 meters from other children can be maintained, they say elsewhere that the rooms with the staff person and the 4 kids have to have that 6 feet apart anyway. So to me, I found that blurb very confusing and it almost like it's moot. I mean, except for the part, the parent is to be notified. And of course you want to know what as a center, you'd want to know, what do I do if they develop symptoms? And of course you're going to notify the parent. But do you understand what I'm saying about that little blurb? They're to be isolated but then it says,
I think, Heather, part of that blurb is depending on every center, right? So first off is you wouldn't be able to open 5 rooms because that would be above your 20 maximum per building. So you'd have a spare room. But let's say, for instance, if you bring them into the office of the director, well, the director can't be sitting at her desk if she's not 6 feet away from the child. Or if you have 2 children who are experiencing symptoms, maybe they're siblings, who knows? But you wouldn't be able to put both of them in a room with a staff member to watch them if you cannot maintain that 6 feet distance. So once the symptoms are done, that another thing that's not on here is that if any child develops symptoms immediately, especially if the child will allow, everyone has to put on a mask. We don't wear masks throughout the day, but then you would put on a mask. So, but you really have to make sure that if a child shows symptoms, that you can put them somewhere where they won't be within 6 feet contact of anybody else. And it might not be, it might not be in an office. It might be, it could be in a hallway, or it could be in a separate classroom, or but you wouldn't put them in a room where there's somebody else.
Gotcha. So, so you brought up masks, because I didn't see masks anywhere here. And one of the other things that some people had brought up was that it doesn't make any mention of children having to change their clothing. It doesn't make any mention of staff members having to change their clothing. And so, but it doesn't say that you do have to put a mask on in that situation in this document.
Well, that's verbal conversations with the department that we had on Zoom meetings.
Okay.
They recommend, it's a recommendation, not a protocol. They recommend that if child starts to show symptoms, the staff member that's with that child and that child should put on a mask.
And they use the word should or must?
In the conversations, I'm going to say it was should.
Okay.
Because masks are not required, and it's the same as they don't want you to use. This is all operational. We'll talk about that later.
Okay. Okay. And so I went to the next page. So I found this interesting here. Parents must be reminded through visible signage. So we're all making, now did they provide these posters, or did the centers make?
The province is making all the posters.
Okay. Okay. Gotcha. And when children are first registered, to check children's temperatures daily before coming to the center. So when they're arriving and they're signing the document, the center is not taking the child's temperature upon arrival, and the staff member, and we're not taking the staff members' temperatures upon arrival?
Okay, what happened in that instance is for the phase 1, what's happening currently, they are. As soon as a child walks in the room, they're taking the temperatures. They have to change the probe cover and everything, but they're taking them as soon as they walk in, and they're taking the children's. Starting on May 22nd, they're going to this. They're going to, it's optional. We don't have to take the child's temperature unless we see they're pale looking, or unless they look a little bit lethargic or whatnot. But it's by choice. There are some centers who said on the meeting last night that want to or not, I'm taking every child's temperature before they come in. You know,
because you could make, you can, like, just like in Nova Scotia, you can make your own individual decisions as long as you're still adhering to all of these things. Okay. Exactly. So for people watching / listening to this, I read all of this. I did not have anything that came to my mind. I'm looking forward to getting back to your face. Same thing here. I didn't make any notations. I found it fascinating, but again, when we're talking face to face, I did find it fascinating that parents are providing the meals and snacks. I'm assuming your centers typically have cooks.
Yes, they have. We have cooks, or we have catered meals in. Okay.
All right. So we'll talk about that face to face. So then I loved the appendixes. I loved them. And I love that the government now, so did they say when they developed these and they sent these out, did they say that do centers have the option to make their own screening questionnaire, or they must use this one?
This one, we must use this one. And if an inspector comes in, she asks to see that we fill them out.
Okay, excellent point. And then they give you the sanitization and enhanced cleaning. So now I'm going to be super honest with you again, because this is the first time I've shared screen on an iPad. When I click stop sharing screen, then, and I go back to Zoom. Oh my God, it worked. I'm so excited. Because I practiced over and over and over again. And every time I tried, I couldn't get back to this point. So I'm so excited. So yeah, so just, when did you get this document?
We got this document sent to us when they were advertising to look for centers to volunteer for the reopening of emergency childcare, they sent this out to centers and said, if you reopen, here are the protocols. So we've seen this document already. What we didn't find out until just this last week is that this will be the same document for phase 2 and 3. So we didn't realize that it would be the exact same document. We were kind of waiting to see what they were going to change in it, but they didn't change very much.
So recently I had shared in the big group, I think, might be wrong, but I feel like it was something from CBC coverage about Quebec daycares, I believe. I do know that I just feel like, you know, I'm sure you're the same. Like, it's like every day since March the 15th has been a blur. We don't know what time of day it is, etc. Don't know if we ate yet or not. And it just seems like we've read so much and Zoomed so much that everything just sort of just is all blurring together. But I know that something that I shared recently caused quite a kerfuffle, and people were very scared. And I had shared it with Corey, who over the 7 weeks, restrictions have gotten tighter and tighter and tighter. And I know that, you know, that she's actually, you know, the United Kingdom had asked her to speak in a group, and New Zealand and India recently discussed having her do stuff. So when I sent that to her, that particular article, she said, whoa, she said, wow, that sounds restrictive. And I sort of thought, oh my God, if she finds it restrictive, because when I read this document, this seems really doable. And this does not seem, I mean, it still takes you aback. Like, if you're a large center, the idea of how the heck do you select what children?
Yeah.
Right?
Yeah, I think part of what we did last night, which was really great, is after we finished our meeting with the government officials that were there, they broke us up into smaller groups. Like, Zoom is amazing. Did you know you can break up into small chat groups? Take your 100, there was 140 of us, I think, online, and we all broke up into small groups of 10. It was like amazing, all through Zoom. And each group had one facilitator who is currently one of the centers that are open. And we were allowed to ask them all kinds of questions. What are you doing? How is this working? What about the playgrounds? What about children's bicycles? What are you doing to keep them outside if you're not allowed to be on the big, large play equipment that you can't disinfect? So we were allowed to do a lot of that last night. So it was really interesting to find out that a lot of them said the same thing. When we started this, we were scared as hell. We were nervous. We were upset. We didn't know how it was going to work. But after you got into the routine of 2 or 3 days or 4 days or even a week of the new norm, because this is going to be our new norm for the next 3 to 6 months, who knows, it works. It actually is very feasible. The children get with it. One of them was saying that she has a little guy that's 23 months, and he knows as soon as he eats, he washes his hands. As soon as he, coughs into his arm, he's got to go change his shirt. As soon as he knows all these things, and they're getting it. And I asked about the well-being of the children. I was worried about their mental health. What is it like being in a room, always being told, no, you can't play together? Here's one little guy in this corner with his set of blocks and another little guy in this corner with his set of blocks, but yet they can't be together. The reality is they will get together once in a while, but you just have to keep disinfecting and, doing your best. But kids get it. And some of the educators actually said that they were excited because they were in a classroom and they might be allowed to take 4, but they didn't have enough children that met the criteria, so they only had 2. So they spent their whole day with 2 children, one-on-one, and did some fabulous and some great things with them. So once they got through that initial fear and scared, it actually is working out for them. So I'm kind of excited about that, because I have a lot of my staff who were scared and upset, but I think that it's going to be the new norm. It's what we're going to have.
So, oh my gosh, ADD really sucks.
I know, because I'm jumping all over the place.
I know that it makes us supposedly so much more creative and resourceful, supposedly, but it also it's like you just don't have enough places to write all your lists. Because when you just said that, when you said the little guy knows that if he coughs into his elbow, he needs to change his shirt. So that's not in the document.
No, but those are just things that they started doing to make sure that germs don't spread.
So those are those like what Corey said? Like, she gets emails that as of today, start teaching the children that they have to change their shirt, or like is that an individual center's decision, or that is a thing that every center?
I think that was just that educator's decision. She just, was over vigilant about, coughing or what happened. So.
And so these amazing conversations that you had, and I did see some YouTube video that said in Zoom, you can break off into all those little groups. I didn't know how to do it because I don't need that skill at this point in time. And my sponge is feeling quite full right now, but that's cool. But all those conversations, like those great questions, like the playground and everything else, again, they're not in your document. So are you guys like, did you take a bunch of notes and you're writing them up? I mean, like Nova Scotia, what Quebec put out for restrictions for elementary schools and daycares is far more restrictive than what you have. And so we don't know. We don't know if Nova Scotia is looking to New Brunswick. We don't know if they're looking to PEI. We don't know if they're just sailing their own boat and we're going to get this document that just has a completely different feel to it. I think you may have seen, since you watched my Facebook Live, I mentioned Dorothy's post because she's with Kids and Company, which is across Canada. All of their locations, like she was being reassuring to us in the group that, it's different in every single province, but it's because you guys are so close that I feel a little bit excited and hopeful that when I read your document, I'm like, oh, because some people, like for Corey, it was only maybe like 2 weeks ago that they got the notice that children 2 and up had to start wearing face masks. And they were taken aback by that and had to get their heads around it and had to get their parents' heads around it. But what they have seen, and so it's so fascinating that some big presenters, just a couple of them, have made commentary on that and judgment on that about how wrong that would be. And so I had been in a Zoom group with a bunch of people, including like a bunch of providers that I think the world of from around North America and some presenters, and they talked about how a couple of the people said you can't have an authentic interaction with a child with masks on your face and the child's face. And so one person acted as devil's advocate and said, I'm not disagreeing with you. I'm just saying, from here up, there is the eyes, which are one of the most important features of the face, and there's all these muscles. So I mean, in all of these situations, even though it's not developmentally what we know children deserve and need and truly understand and grasp, it's a different situation. And so like those children that were used to, prior to March 15th, coming to daycare and crawling all over each other. And when I say that, I don't just mean toddlers and infants. I'm talking even some preschoolers, right? Because they're just like, dog pile, kind of thing.
Exactly.
And so you have to try to explain this to them. I mean, it's just with toddlers, I would imagine, it's just like continually separating them for that first day or that first every whatever. And after a little bit, they get used to it. And so now that Corey's program, children have been wearing masks now for a couple of weeks. The children are used to it now. And like Corey said yesterday in that thing we did, that joint review of a blog post, she looked at me and she said, this little girl, she said the other day, hi, I'm so happy to see you today. And, you can see that the person's smiling, even though they have a mask on. And the little girl looked at her and said, I'm so happy to see you too, Miss Corey. And it was a real moment. So
wow.
to me, my thought,
we don't have to, we're not at masks. So I'm just glad we're not at masks.
Yeah, absolutely. I guess what I'm just trying to say is that if it's a good center and you're really good at establishing really great, meaningful relationships with your families and, more importantly, the children, and you've always been good at that, you can, with all of these restrictions, still do that. And because it's the same as if they have a good home environment, because it's Maslow's hierarchy of needs. So if they feel
Exactly.
secure and they feel a sense of belonging and they feel safe and all those things, then they're comfortable enough to interact and to engage and to play. And it's the same for us as adults. Because if we're just stuck in that reptilian part of our brain, petrified all the time, it's not like if you and I signed up for, it's like the next 2 years, right? Because there's no
Yeah.
vaccine. And so dramatically I lose weight and get healthy and I join some running club and you and I sign up for some running workshop or something like that. If I'm only in my reptilian brain and constantly fearful and anxious, I wouldn't be able to do that. But you get used to it and you adapt. And so children are better at adapting than adults, don't you think?
Definitely. And I think that part of me feels guilty because really we're looking at children to be resilient. We're looking to children to adapt. We're looking to children to be able to make all these things. But you know, the one good thing is that our trained educators are ready for that. That's why they went to school. That's why they have their training. We're not putting these children, and that's one of the things we talked about too with the province and within our own directors, is that we're not looking at being just childcare givers or babysitters for fear of that word. We are looking at still being able to provide them some educational opportunities, some learning through play, some building of relationships, and some social and emotional regulation, and helping them navigate this whole COVID-19 world. I mean, you figure these kids have missed their friends and they've missed their school and they've missed their grandparents, and they're not allowed doing what they used to do, and they're stuck at home because they're not even allowed to go to the stores with their parents. And you know, I mean, these little guys are coming to us already with this COVID-19 as this big cloud above their head. So it's going to be us that's going to be able to, with our training and with our knowledge and with our experiences, help them navigate this. So it's kind of, I'm kind of excited in some ways to open to help these kids with navigating this procedure and navigating this COVID-19, because I really think that, you know, staying with aunt down the road while mom works, or grandma or grandpa, or all of those things are wonderful, but we have that ability and that training and that background to be there for them in a way that untrained and unprofessionals and family members might not be able to.
So absolutely, like totally with you on that.
There's a part of me that's excited, part of me that's still, oh, but you know, I mean, we're fortunate in Prince Edward Island. We only had 27 total cases, and all 27 were travel related and all self-isolated. We did not have any community transmitting, none. Nobody caught it from anybody. It's all people who arrived from out of province, out of state, out of country, who had it. They self-isolated. Out of the 27 cases, 26 are now recovered. The one active case was only found at the beginning of end of April, and that person should be recovered before we go back to work. And then, so I'm presuming by the time we go back to work on the 22nd, that there'll be no cases, no active cases at all.
So that could be a serious consideration with regards to the people who develop the restrictions, because
Yes.
Obviously Quebec has had it. I had thought Ontario had it the worst, but Quebec has had it the worst. And then certainly we've had more cases than yourself. We have had community spread. Yeah. So how do the centers, I was just gonna pause for a second and say how sad I am for all of the loss of lives in our seniors' homes here in Nova Scotia. So how are you guys figuring out which children to attend?
So right now we sent out some surveys to our parents. Do you currently work outside the home? What is your work? Do you currently work outside the home? Do you have another adult currently caring for your children, or how have you cared for the children for the past 7 weeks? What is your plan going forward, and what is your needs? And then virtually we have to make sure they meet the criteria. So the criteria is, if you're an essential worker and you work outside the home, and there's no other adult in your home to watch your children, and you have no chance to, you don't have any childcare available. Or it could be somebody who's returning to work on May 22nd with no childcare available. So they have to have that no childcare available currently. What happened is, when they first started this with the emergency care, they thought they had over 350 children. Turns out they only had 56 who really qualified. So they're estimating that our numbers are going to be very low, and we probably will not open with 12 or 15 children the first little while. They're presuming we'll open each center probably with 4 maybe 8 children. So that's sort of what we're looking at. Now, when it comes to staffing, the interesting thing about staffing is no matter how we staff it, all staff who are currently staff members are going to continue to receive their 40 hours of salary. So if you have an immunocompromised staff who cannot work, if they show proof with a doctor's medical note that they are immunosuppressed or immunocompromised, they can stay at home, and we do a work at home plan. So it might be that staff that continues to put Facebook posts of story time or reading or activities for the children who are not coming to the center. So that staff would do that, but they would kind of have a work from plan home. All other staff are required to come back to work, otherwise they're laid off. But they only have to come back to work part-time. So what we're going to do is if we have a center that is only going to take 4 or 8 children, really for 4 children, I need 1, 2, 3, 4 staff. So 4 children, 4 staff. So I need a staff to work, because we're open 7:30 to 5:30, that's 10 hours. It would work best if we had 1 staff for 5 hours and 1 staff for 5 hours. We don't have to worry about lunch breaks and all of those things for our staff, because at 5 hours, you're not required by law to have a lunch break. So we'll have 5 hours and 5 hours, and then you're allowed a floater who's going to be doing the disinfecting and the cleaning. So we'd have 1 floater for 5 hours and 1 floater for 5 hours. So 4 children would require 4 staff. 8 children would require only 6 staff, because it would still be the same 2 floaters and 2 staff per classroom. All of our centers may have 10 or 12 staff. So the province is giving us the leeway on how we work that into the staffing. Who comes to work, who doesn't come to work, what children come to our center, how to choose our children. They're giving us a lot of guidelines, but we have a lot of leeway on how we're doing that. So even if we only have, for instance, 4 children and 4 staff, my other staff are still going to be paid full-time hours. The province is going to reimburse us for all those lost parent fees that we're not going to be getting because we only have 4 children. And the province is going to continue paying and continue subsidizing those. And those 4 staff would work part-time hours. It also gives us a chance to have substitute staff. So if one of our staff do get sick or one can't make it, or then we have some substitute staff on hand. We are allowed to rotate our staff. So for instance, this set of 4 staff could work for 2 weeks, and then this set of staff could work for the next 2 weeks, always knowing that it's always best for children to have consistency and routine. So we don't know how we're going to look at that yet. And we can start out opening 1 classroom with 4 children and just those 4 staff in the building this week, and then slowly next week or the week after open up that 2nd class. So it's not like we have to get out of the gate running and have 4 classrooms with 16 children and staff in the building right away. We have to do it in a way that's going to make it work for us. They're giving us a lot of leeway. Like, they're allowing us to make decisions within our center to be able to make this successful, and so that the staff and the families feel supported. So a lot of stuff happens.
Wow.
That's all operational.
That almost, like, part of me is like so excited and thrilled that you have that leeway, but it almost feels like a little bit too much leeway too, because it's almost like in weird situations, you sort of want people, like I'm often someone who takes charge, like even like not in my own role as an administrator, just like in life, if I'm in some weird situation in an elevator that's trapped or whatever, I might be like, hey guys, this is what we have to do, blah, blah, blah. But there are times that I enjoy, like if I'm super stressed out or in that reptilian brain mode, that I want someone to just make the decision, just tell me how to do it, kind of thing. So it sounds good and bad at the same time. So you said some stuff about rotating staff, or like, they're giving you the leeway so you can have these staff working these couple of weeks and then these staff. And obviously when you say substitutes, you mean your other staff, but you also said a statement. You said a statement. So if a staff member is immunocompromised and they have medical documentation about that, then they are staying at home and they're getting their full pay. But what about a staff member who perhaps is not immunocompromised? This is like a hypothetical thing, because anxiety is very, very present. in this situation. So what if somebody has such severe anxiety that more from a mental health perspective, they and their doctor feel they can't work?
Every case is going to be based individual. So we had one lady last night. So somebody who has severe anxiety, if they have a doctor's medical note, then I believe that would qualify for them to stay at home. But that would be something on each individual case basis that we would discuss with the department about. Right now, they've only stated immunocompromised, but I'm sure somebody with severe anxiety, we wouldn't make them come back to work. They would probably have a work from home plan. We also have, like for instance, somebody whose husband is a truck driver, and that truck driver might leave and go down to the States for a week and then come back for a week and have to self-isolate. So we did a lot of conversations last night about that. So it might not be just the staff member itself, but it's who lives in their household and how are they immunocompromised, or how are they affecting COVID and self-isolation, and how are they affected by it. So they've asked us to kind of take each individual situation and either work it through with them or figure out a solution. But the only people who will not be paid are those who are refusing to come back to work with no valid reason.
Okay. So refuse to come back to work with no valid reason. And if it's a health condition other than immunocompromised, then that obviously they need medical documentation.
Yeah.
And then the center then sort of connects with the department and discusses it. And it's likely that it would be covered, but of course you'd have to connect, because
I would
now,
say it's highly likely. Highly likely. They are very flexible to meet our needs. They also discussed, for instance, a staff member who has their aging parent living with them. Like, all of these discussions are had within these Zoom meetings. So if you have a staff with an aging parent who lives with you, perhaps you're not immunocompromised, but that 75 or 80-year-old parent that you have living with you is. So you don't want to be bringing back all of the germs and the possibility of sickness. So even though that we have no active cases right now and we haven't had any community transmission of the disease, they're really looking at staying as safe as we possibly can, just in case. We don't know who's going to come over that bridge tomorrow, what truck driver might come back from Florida or New York or somewhere in the States and bring it with them. So they're still taking very high precautions to make sure that there's none. And they're willing to work with us. So if we have a situation with a staff who can't work, we talk to them and we make it happen. All of our centers do the online thing, sort of like what you're doing. Like, all of our centers are doing online activities with our parents, and they have chat groups, and they have meetings online, live meetings once a week, and they read stories and do things. So any staff who won't be working physically in the center would be doing work from home, such as that.
Now, that brings up a question. First off, let me remember that work from home thing. But I was going to say, as much as I'm a proud Nova Scotian, part of what you're saying is making me want to move to PEI. In Nova Scotia, on the 16th of March, our consultants all sent us emails to all the centers with suggestions of things that the ECEs could be doing at home. But there was nothing stated, like there was nothing that said ECEs are to do webinars and they are to do such and such. And so I do know of many centers that have had their ECEs doing things, whether it's webinars or having Zoom meetings, reviewing an article together, or doing video storybook readings for families, or written posts or whatever. But then there are certainly quite a few centers where their staff are required to do nothing and they're getting their full pay. And so that's been hard. That's been really hard, because the centers that have developed a work plan from home, ECEs talk to each other. And so I'm curious about PEI. When you all had everything go down, did you have something from the department that said that every center, every ECE was to be doing so much, or no?
We had exactly like you. We had recommendations of things you could be doing, and it was your choice if you did them or not. But once people started doing it, it kind of like the influx. Like I had currently run 5 different centers one of my centers started to post things for the parents and activities. The other 4 saw it and they all jumped on board and did it. So it was kind of like, you know, it just evolved. But what changes is as of May 22nd, any ECE staying at home must have a work from home plan. Up until now, it's been optional. A lot of ECEs just sat at home, knitting, doing puzzles, baking, painting their house, whatever it is they want to do. But starting on the 22nd, any ECEs that's paid that stays at home must have a work from home plan.
And so let's move to the cook, or
Yes.
centers that have crazy budgets and have like a maintenance man, or maybe their cleaners part of their staff. So what's the story on them?
Up until now, they've received full funding, so they've been continuing to be paid as per the ECE. So it was all your staff that were continuing their pay. Once we reopen, right now they want children to bring their own meals, so we don't need the cook, but the cook can be part of your disinfecting team. They can be the one meeting and greeting the parents at the front door to fill out those lovely questionnaires. They can be part of the team, and you could have them into the rotation of staff. What they've asked us to do is kind of try to make it equal. So if you're a staff that works 40 hours a week, you might go down to 25 hours a week with this new plan. So if you're a cook that works 20 hours a week, you might go down to a 10-hour week. So something sort of like that, but we can incorporate our cook and our other staff into our current work plan. We do have when I mentioned earlier that on the meeting last night, they came up with 3 changes. I'm just trying to look in my notebook here. The 3 changes are, let me tell you them. Should a center be capable of offering lunches and snacks, they can bring that back as long as they come up with a protocol on how they're going to do that, current washing policies of dishes, et cetera, et cetera. So starting on the 22nd, those who want to provide lunches and feel that it wants to be part of their program, they can. Now, my centers are not going to. We're going to remain with the parents bring their own lunches for phase 2 and 3, and then we're going to bring back the lunch service in phase 4. The other one is they did tell us that as of May 22nd, we are no longer required to take the children's temperatures in the morning unless symptomatic. But a lot of centers said, I don't care, we're taking them anyway. And the third change is up until now, the centers that are open for emergency care were told not to use their playgrounds. And because the large equipment like slides or swings or things like that can't be sanitized. And you can't have a group of 5 out there at 9 o'clock and them come in at 9:30 and another group go out at 9:30 because you sanitize nothing. So one of the new changes is, especially for the fact that we have no COVID cases right now that are active, we are going to be allowed to play and use our playground, but it's going to be our center playground only, so that we know that this is the only area that the kids have played on. We're not allowed to go to the school playgrounds or the neighborhood playgrounds, but the center playground only, but we only must have a maximum of groups of 5 at a time. So those are the 3 changes to the current list that I sent you that they brought out last night in a verbal meeting with the directors. So those are kind of like the 3 little things. But as far as the cooks go, they can be part of your work plan and they can be part of your reopening. You just have to figure out how you want to work them into it. It's really going to be a team effort. So work with your team and see how they want to make it happen. But a cook can come in and be the disinfector. They can come in and clean toys for you while you're teaching. They can do all that, those sort of things.
So do you have, like nothing is written about like the directionality of like you can only walk one way in a hallway, and if a teacher is in one room, they stay in that same room for the entire day? Yes?
Teachers,
like
yes.
Like you said 5 hours. So for 5, that's their room, other than they might go pee.
And you cannot mix children. That's a definite no. So in the early morning and in the late afternoon, if you have 2 children and 2 children, you can't mix them together. Children are assigned their classroom. They stay in that classroom. No mixing of classrooms. You can't go visit another classroom if there's not very many kids. You can't mix in the morning and the afternoon like those ratios. So that's why we had talked about doing 5 hours and 5 hours, because virtually at 7:30 in the morning, you may require 3 or 4 staff. And at 5:30 at night, you may require 3 or 4 staff. So that's why we talked about doing the 5-hour shifts. There are centers who are keeping their staff on for the whole 8-hour days, and they're using their cooks for that last 3 hours, or they're using their substitute staff or their part-time staff or their special needs staff. So depending on how the center wants to do it, but what we've looked at that we think is going to really work well and what a lot of centers are looking at is that 5-hour shift. Because we will have way too many staff. We have to get them all back to work somehow, right? But if a staff comes back to work for 5 hours a day, they are not required to have a work at home plan for those other 3 hours because they have their work plan. Their work plan is that 5-hour day. We all know that they're probably going to do some programming, or they'll get their plan ready for the next day, or they might think about their next day anyway, because early childhood educators are like that and take their work home, most of them. But as long as we have a work plan for each staff.
So some clarity. So a couple times during our conversation, you have said all centers have been doing posts. And so when you say all centers, do you mean like all the 5 centers that you administer kind of thing? Or do you mean all centers in PEI?
All centers who I administer.
Because
but I do know that, let's say the most centers are doing it. It might not be each and every one. That's my ADHD, I think, globally.
Because I think in Nova Scotia, and I could be wrong, but I think most centers aren't doing them, is what I think. I think a chunk are, but of course I don't know. I think we have more centers than you. And I don't know. I didn't do a survey. I didn't do a statistical analysis, but some ECEs felt compelled to point it out to me. So, yeah. So
I think when we have Zoom meetings and things, there's a lot of people talking about it. So those that are quiet who don't talk, I probably could not be doing it. I'm not sure, but I know that a lot of people are talking about it. And, you know, I see some centers sharing posts from other centers sometimes and say, look at this cool activity. And, you know, you can tell that the post has been shared a few times. So I think that there is a lot of it happening, probably not all centers.
I don't think we thought ever before, like, you know, when Facebook first came along, it was all about like, you know, it was not professional to be on Facebook. I feel like I've been on Facebook more in the past 7 weeks than I've been on in my whole life. And like at 9 a.m., we assemble as a team in a big Facebook chat to say like, good morning to each other and how are you and whatever. And then we have a Facebook chat for the preschool team, and we have a Facebook chat for the toddler team, and so in my mind for years, because we're supposed to celebrate our 25th anniversary in September, you know, you always sort of thought like there were literally times, Kathleen, you're going to laugh at me, that if a staff member came into the office just to chit chat or something, and I had Facebook open, there were occasionally a time when I'd say, well, I'm about to post on the Kids Are Kids Facebook business page, like a note for parents, whatever, because you just didn't think of it. And I've often thought, like I Googled looking for other professional messenger applications, because yes, we have had Zoom staff meetings, absolutely, and we've had Zoom circles with children, but you know, just for that first 10-15 minutes in the morning when you want to say good morning, do you really want to Zoom? Like, you know, you're in your jammies, you just curled. I mean, you can tell, like, I
think I missed you. I think I missed you, Heather. I think I'm looking at the time thinking, does she realize when she goes to post this video, it's not going to be 33 minutes? I think we passed an hour and some odd minutes.
Whatever. If they watch it, they watch it. Okay. So thank you for everything. It's so much to think about. I love your restrictions. I love them. I think they're so doable, but I don't want to get too excited, because PEI has had less cases, etc. So that might directly impact the level of restrictions. But yeah, so thanks so much.
The other thing about these restrictions is at any point in time, our equivalent to Dr. Strang, which is Dr. Heather Morrison, can come back and say stop. So if anything happens, if there's another outbreak, or if something happens that we get that second wave of COVID, at any point in time, she can halt it, or she could put us back. So let's say, for instance, if we get up to phase 4, where the restrictions lessen a bit, and all of a sudden there's a few cases, she may bring us back to phase 1 or phase 2. So like, we're going by this, hoping that the COVID stays at bay, or at least across the ocean. Not that we want New Brunswick and Nova Scotia to have it, but that is across the ocean, and that it doesn't come here. So we're hoping, but you know, at any point in time, she can come back and say no, you know.
So are you saying you don't want us visiting you this summer on the island?
Unfortunately, no. Although I want to come over there. I miss my granddaughter. She's still over in Halifax. All my 3 children are there. So, you know, I hope to get over there at some point in time, or her to come here, but I don't foresee that happening until probably late July, early August, if everything keeps going the way it is.
I know that we're going to end, but I do definitely have more questions, but I just like the leeway thing. Like, how do you know what's a leeway and what isn't a leeway? But I guess you guys have just worked your way through those questions. It sounds to me like you have some really great Zoom things, like this Zoom thing last night. Were there government people there, or it was just a community?
Yes, the head of the Department of Early, like we have our Department of Education and Lifelong Learning. Well, the head person, Doreen Gillis, who's in charge of the Early Childhood Education department of that, was on the Zoom meeting, as well as Carolyn Simpson, who is the advisor to the Minister of Education on Early Childhood Education, and she is also the COVID. I don't even know her title, but she's in charge of the communicable COVID file. So she has 2 files. She's working on the COVID file and she's working in early childhood education. And she was on the meeting last night as well as Sonia Hooper from the ECDA. Sonia has been doing some marvelous stuff and helping us get ready and organizing things. And she's been available for question and answers all the time as well.
So was that the first time you've had was that your first time that you've had a Zoom in this entire amount of time with government people in it, or no?
No, we've had 3 or 4. And we actually have one scheduled. That's
amazing.
Yeah, we've actually had them 3 or 4 of them. And what happens is you sign up for the Zoom. They ask that only one person from each center, because otherwise we'd have thousands of people on the Zoom, or the director or the supervisor. But if you're an ECE and you really want in on that meeting, you just sign up and you go. Like, so we've had anywhere from 230 people to 150 people. And actually, after last night's meeting, they told us that there will be a standing meeting every Wednesday night for the next 3 to 5 weeks. So every Wednesday night at 6:30, we're going to have a meeting with these department officials, and they listen to the directors and they take our questions. And you know how Zoom works with that chat room where you can, you know, type your questions. We type our questions and they answer them as we speak, or they go back and they print off all those questions and they answer them and they send us all the answers by email. So they've been really there for us to answer questions. And you know that I feel like Prince Edward Island is supporting the ECE sector in 1,000 ways, and it's amazing.
Wow.
It's not us against them, it's us with them.
So we have certainly felt like the province has our back financially and operationally and everything else, but there's been nothing like that. And that me saying that, I'm not criticizing because we're bigger and we have more COVID going on or whatever, but that sounds so interactive and amazing and teamwork wise and everything. Because as we get started, we'll have those questions like sanitizing a playground or whatever, or what do you do or what do you do? And wow.
Yay!
My God, so many reasons I want to move to PEI.
There you go. Right, there's lots to do here.
Thanks so much for all of your time.
Well, I'm on your site, on your ECE HRM and Beyond, or HRM in Nova Scotia site. So if you come up with any other questions, just jot them on there. I'll follow along with the post where you posted our document. If there's any questions we didn't answer in today's interview, I'll definitely go on there and answer them the best I can. And if anybody wants anything else from, you know, to find out how it's going in PEI, I don't mind touching back and base with you after the 22nd, depending on what you guys do in Nova Scotia. If you're open, you might be busy. But if you're not open yet, you want to know how it's going, we might be able to touch base again after the 22nd.
Okay. All right. Thanks.
Thanks, Heather. You're awesome.
Have a nice afternoon.
I will. Bye-bye.